Action.
Hi, I'm Darish.
Hi,
Nice to
Darish.
see you, Darryl. So I'm basically here today from the Asthma Right Care team. I know you see quite a few asthma patients here in the pharmacy.
That's correct.
And today's really about, the blue inhaler, salbutamol,
Yeah.
or the SABA, as we sometimes call it. And it's just basically trying to ask you a few questions around the number of canisters you might see for a typical patient in a year for salbutamol. And I know with asthma it's quite broad with regards to asthma control, and there's various questions we can ask to see how well a patient's asthma is controlled. But this is in particular about SABA usage and what you would typically see.
Okay.
All right. So we've developed things like an asthma slide rule, and what this does is asks, or just raises it, makes people aware of the number of salbutamols that maybe that can cause potential concern to you, for example, as a pharmacist. What number of, do you know how many doses there would be in one canister of salbutamol?
200 doses.
You know that, that's good, yeah. So, and how many of these 200 doses would you see typically for one asthma patient, say over a 12-month period?
Typically, I probably see about 6 inhalers.
6 of
Yeah,
these,
I would expect one every 2 months.
One every 2 months with the typical
For the
patient.
typical patient. Yeah.
Okay.
Somebody who's obviously got a bit more of a problem, then we tend to see about 2 a month at times as well. But yeah, typically for us it's usually one every 2 months.
Okay. And so for a well-controlled asthma patient, from what you know, how many times do you think an asthma patient should use their blue inhaler, typically, say in a week or in a day?
Well controlled, I'd probably say about 2 to 3 times a week ideally, if it's well controlled. If it's obviously poorly controlled, I'd be using a few times a day.
Okay. So I wanted to get your thoughts on this slide rule, which you were talking about, for example, 6 you may see in a typical year. So that shows that there's 1,200 doses per year.
Yeah.
So if you're looking at a patient who's well controlled, using around 2 to 3 doses a week,
Yeah.
this is highlighting that that's 23 doses a week.
Right.
So the question really is just to make healthcare professionals like yourselves aware of this and what you typically see. I can see you're obviously very knowledgeable about the salbutamol number of uses, but what sort of level would actually get you sort of worried to the point that you would actually maybe sit down with a patient and do an MUR or medicine use review about it?
Well, looking at this chart,
Yeah,
that sort of number would actually worry me.
would it? Yeah.
For somebody who's obviously well controlled. So yeah, that's actually quite worrying. 23 puffs a week.
Yeah.
A bit.
So on the back of it, we've also got questions around confidence. And so on a scale of 0 to 10, when 0 is not at all important, confident, and then extremely confident, or how confident would you feel to have that conversation about reducing the number of doses of salbutamol with a patient?
I'd probably be on a 7 or 8.
Okay. So what makes it a 7 or 8 and not say a 5 or a 6?
I think I would, I'm quite confident about talking to them about the technique, making sure that that's correct. Because quite a few times when I've spoken to patients, I've realised that the technique is pretty wrong. So talking to them about it, trying to get them to try it out in front of me makes a big difference.
Good.
Speaking to them about spaces as well, that also makes a difference. So I think I'll be pretty confident with that.
Good. And so the last questions we've produced these cards, and one of the things that we would ask is, for example, when if you've got a patient with the salbutamol, how many of the inhaled corticosteroid prescriptions would you see, or canisters would you see typically in a year for a typical patient? Or the other question we'd ask is, what would be the ratio of blue and brown?
I tend to see more 2 brown compared to 1 blue.
Okay, well that's interesting to see. So you typically, or ideally, see maybe 12 brown a year, but
That's correct, yeah.
and maybe half the quantity of blue. And what are your thoughts about adding salbutamol or Saba onto repeat prescription after this conversation we've had today, for example?
I think it would have to be reviewed a bit more regularly, to be honest. Whether putting it on repeat for a set number of times might make an issue, because you wouldn't be able to pick up compliance issue until it's a bit too late. After you've given 6 inhalers out or something, and you think, okay, well, this has gone quite fast. So,
All right.
It would be a concern, I think, that one.
And the last question is a challenging statement, which is around, for example, if when it comes to the salbutamol, and that you may see, have you heard this statement before? Well, I use the blue inhaler to open up my airways before I use my brown inhaler.
Yes.
Have you heard that one before? And what's your thoughts about that?
When I initially qualified, this was what I was told through my tutor as well. So I believe it's an old sort of way of telling people how to use the inhalers, and that has changed quite a bit. So I mean, we do try to push the fact forward that you should be using the brown inhaler more often on a regular basis, and the blue inhaler just as and when you need it. But yeah, we do still get a few patients who come in and say, actually, I use my blue inhaler just before the brown inhaler. So, yes.
Okay. Well, thank you so much for your time.
No problem.
I know how busy you are. Thank you very much.
Thanks,
Take care.
Thanks.
Press red.
Red, please. Yeah.
Red and red.